Good morning. Welcome to all of you. Happy Saturday for all of you regular viewers. I'm so excited to have you join me here today. Let me get this adjusted right. Okay, so today is Saturday, and we are going to go over a whole bunch of new news regarding the surge that the U.S. is experiencing here with coronavirus. Also, I'm going to share with you some new data out of Columbia University and the medical program up there, highlighting some pathologies and information that I think will be impactful for us to help understand just the severity of this virus on our body. So for all of you, welcome, and you're new, please subscribe, hit the subscribe button, hit the follow on Instagram. I'd love for you to be a part of our community. For all of you watching on the live or on the replay, comment down below and let me know where you're tuning in from. So I love learning where we have our viewers, where you guys are located, what countries you live in. And it's just been really great to see so many viewers from all over the world join us to get information. So today I want to talk about specifically this research. So this is out of Nature Medicine. Is an article that came out about the extrapulmonary manifestations of COVID. So basically the whole entire body system. We're going to talk about some autopsies that have been done on multi-organs and glands within the body of COVID patients. And there's some really shocking information that's coming out of these autopsies. And the US remains to be the core epicenter of this virus. So if you are concerned about your health, your family's health, the health and wellness of your friends and family, please hit the like button. This video, particularly today, I'm going to talk about some natural resources and ways to bolster and fortify your body to help ultimately equip your body with some of the strength it needs in the event that you do come down with this virus. This is a multi-system disease. And because of that, we need to look at nourishing and supporting multi-systems within your body. So that's one of the things as a naturopath, this is my expertise. It's my specialty in looking at the whole entire body globally and helping situate your body so that you're healthy and well. Now, as a disclaimer, none of these resources are specific to COVID. So I just want to make that clear. We have no sort of clinical research or data. Really, there are no therapeutics that we know clinically 100% are the therapeutics for use in adjusting and addressing COVID. But we are seeing clinical trials in the hospitals. But I just want to make a disclaimer that this is just kind of globally, how do you bolster and support your body? All right, so let's dig in with some news. And good morning, everybody. And I want to thank Pat Wagner, our wonderful moderator. She's fantastic. So today I'm going to share with you what I shared yesterday. Nothing changes right here. These are the world's worst outbreaks and the top 3 cities. Actually, many of these cities in gray. Everything in gray are U.S. states. Number 1, Arizona is the leading epicenter. Number 2 is Florida. And then we have South Carolina coming in at number 3. Number 5 is Louisiana. Honey? Okay. Okay. That's okay, honey. You want to say hi to everybody? So I'm home solo with Gabriel. Do you want to say hello, honey? Say hi.
Hi.
Do you want to tell him what arrived this morning?
A glass, and it's so funny. It's bigger than yours, but it's like a million feet.
Yes. So we got sawed this morning, and so that came really early, around 7 o'clock. We had a huge truck here. Take this too, honey, and go play in your room, okay? I'll be done in about 40 minutes. We had sawed arrive, and so that's the big highlight of today. The guy had a little machine that brought the sod off and dropped it off, and Gabriel was so excited. So anyway, thanks you guys. This is a working mom at home on a Saturday morning. But I want to highlight this. I will post this. I posted it to Instagram. I'll continue to post this. This is really critical. All the gray lines are cities or states. So Arizona is number 1, Florida is number 1, just based on per capita, the percentages of cases per capita in each of the states. So we are seeing major outbreak. Alabama, Nevada, Mississippi, Texas, Georgia, California, Tennessee, Arkansas, Idaho, Utah, and North Carolina. Give me a heart, like button if you live in one of those cities or states, because we need to keep you all healthy and well. And that's the goal with these videos today, or all of these live shows. So let's dig into some news here. The world's at 12.5 million cases. The US surpassed 3 million. We're at 3.2 million cases. And yesterday we had quite a bit, several record-breaking states with fatalities. So we're just a few folks away from 136,000 fatalities due to COVID. The 4 states that broke fatality records were Arizona, California, Florida, and Texas. Arizona had an increase by 79% yesterday. Florida had an increase of 37%. This is an increase in the deaths from day to day. So from Thursday to Friday, Arizona increased by 79%, Florida 37%, Texas 52%. Very concerning. The US, we had our largest positive day of tests. We saw over 70,000 positive cases tracked by all of our states together. California surpassed 300,000 cases. They're at 304,000 cases. And they posted almost 7,800 positive tests yesterday. Their positive percentage rate, that's a number that's really critical. That's the number that's articulating the worst epidemic, worst outbreak per capita. California is at 7.4% in terms of the positive cases. There is an epicenter that has been logged, a company called in LA Apparel Factory. They've had over 300 COVID cases, 4 deaths in June and July already. And instead of shutting down and allowing inspectors to come in to help keep the factory healthy and safe, the owner started to hire new people to work, and those new people got sick as well. So there's going to be a lot of scrutiny on that. I'll keep covering that as I get information. And they're definitely, they saw additional fatalities yesterday. Florida, I want to highlight Florida. So many of you know I'm from Florida, the central, like Tampa Bay area. South Florida has no ICU beds available. Miami-Dade, that particular county down there, they're a positive percentage of cases. So for every 100 that come back, 28% are positive. So they're seeing a positive percentage of 28%. Yesterday, Thursday, it was over 30. It was 33.5%. And Texas posted a near record day. They had their second highest day of positive cases, 11,433 positive cases. They had 95 deaths, and 12 Houston hospitals are turning away individuals going to the ER because they are overwhelmed. Georgia also, for any of you here sitting in Georgia along with us, we're just north of Atlanta. We had a record-breaking day, significant record, over 4,400 cases, almost 4,500 positive cases. That is up by over 1,000 in just one day. So, the day before was like 32,000 on Thursday. Yesterday it was over 44, it was 4,484, so almost 4,500. We are seeing Georgia, we are reactivating a field hospital that is being it's already set up, a makeshift hospital, 200 beds at the Georgia World Congress Center. That's downtown. That's where there's a lot of conventions and things like that. So that is geared up and ready for the overflow. Georgia is expecting they're gearing us up. There's a lot of communication in terms of getting ready for the type of outbreak that we're seeing in Florida. Some other states to notate: Michigan, they now are requiring face masks. There is a $500 penalty for any of the, this is terrible, but the anti-maskers. I've seen a lot of commentary about what we call them, but the reality is that if you are not wearing masks and you're putting other people at risk, you're going to be fined $500. And North Carolina also is another state that broke records. They broke records in their hospitalizations, which is concerning. Usually it's a 2-week delay from the time you have an increase in positives to the time you start to see an overwhelm on the healthcare system. More people going to the ER, more ER moving, ER patients moving to the ICU, the ventilation, the intubation, the oxygen requirements, multi-system organ failures, and imbalances on all of those fronts. So I do want to highlight that there are 3 counties that are the most heavily hit counties in the U.S. So, we have the states that are hit the hardest, the 3 counties that we're seeing a significant surge. LA County in California, Cook County, that's in Chicago, Illinois, and then in Phoenix, Maricopa County. And so if you live in those counties, do yourself a favor and really minimize your outbound activities. Where you can, order your groceries, try to, get creative and inventive with the items you have on hand, order online. But at this point, given some of the percentage of positive cases, it's indicative of major community spread. And that means if you are at risk, particularly, and you have any underlying health conditions, the multi-system disease that COVID is could greatly exacerbate your situation. So do take heed, wear your mask, wear your protective eye shields or face covering, face shields as well. I have those. Here I'm showcasing everybody different options for masking and protecting your body from aerosolized droplets and contamination and contact on eyes, nose, and mouth. Okay, so I want to also highlight some information about, this didn't print that great. Okay, so this is a chart in terms of how many tests, the testing that's happened. And so right now we're at about here. There's the testing, the tests, COVID tests that are happening. There's a lot of communication that we're just not testing enough. So we're starting to see failures like we saw in March, where we don't have all the right testing supplies, the equipment, the swabs, and all of the items necessary for testing. So I want to highlight in just in a week, in 7 days, we've had 38 million tests run. Now there are some backlogs. Some of the capacity is overwhelmed. So some folks are seeing 4 to 6 days, sometimes 8 days, and getting a test to return back to you. So if you have taken a test, you think you're positive or have had exposure, quarantine. That is the recommendation at this point, especially with the lag time. We saw a few commenters on our videos yesterday. One of our live Q&A guests, I believe his name was Steve, had said that he was waiting a test. And so when you wait, when you're waiting, you want to not really have any contact. If we've tested, in the last 7 days, we've tested 38 million in total, and this was kind of the identification of the total, we've had 1.4% of our population tested. So that is not nearly anywhere of what the levels we need to understand the community spread. So there are major testing issues in these 3 states: Arizona, Florida, and Texas, obviously the most heavily hit. They are challenged with getting enough tests. Testing sites are running out of supplies. Arizona, Phoenix doesn't even have a major testing location, drive-through. So they're really overwhelmed by that. And I also want to highlight that there, and this coincides with my research here that we'll go into, but there's a pathologist out of New York, Langmore. So it's a NYU medical-based facility. This pathologist has autopsied bodies, COVID body individuals who've passed from COVID. She's autopsied their organs and some of their glands. And basically, she's found blood clots in almost every organ. And the blood clots are affecting small vessels. And so they're seeing blood clot damage in all of the organs, not just the lungs. We're seeing it kidneys, the heart, the pancreas, the liver. There's discussion that these clots will block the liver bile ducts, which is a whole nother challenge. And the most important thing that they found is that large bone marrow cells, these bone marrow cells, they're finding the presentation of these cells, and these cells actually trigger a production of platelets. They're finding them in tissues that are abnormal. This has never been seen before. So again, this is a novel virus. We're learning more as we go. The autopsies are going to give us more substantial after the fact information that then hopefully we can use to then preventatively or therapeutically use to help people recover and prevent the fatalities. These large bone marrow cells are found in the hearts, the kidneys, and the lungs, as well as the pancreases and other organs of these deceased COVID patients. And that is, in the world of pathology, apparently is extremely mind-blowing. It's never been seen before. So I'm also going to dig into this article because this highlights more about the blood clotting and other aspects of the multi-system disease and inflammation that is caused. I also want to highlight that, on the front of school, so going back to school and how are we going to get kids to school, there's a lot of discussion. Lots of teachers and parents are starting to have extreme angst about how we're going to make this work. In Arizona, there were 3 teachers that were on premise. So they were in their school classrooms, but they were creating virtual summer school in the classroom. So these 3 teachers gathered in Arizona in this Phoenix, Maricopa area. All 3 of the teachers had developed COVID. One of them died. And that is very concerning given the fact that we are going to be looking at kids coming back into school. The other thing I want to highlight, and this is out of the Kaiser Family Foundation, I will post this. They put together an article. They posted that 1 in 4 teachers are at risk. So given the age of teachers and some of the underlying health concerns, what they identified is that 1.5 million teachers, this segment, this light blue segment of this pie, these are teachers that are at risk, high risk. And so they analyzed items like, 24% of the teachers have diabetes, they have heart disease, obesity, over the age of 65. They have risk factors given the CDC criteria of risk factors. And that basically is 1 in 4. So 25% of our teacher population in every school will be at risk. And I know our school, Gabriel School, one of the administrators is managing breast cancer. Like she has chemotherapy and is getting radiation. She would fall in that risk category. And they didn't even identify all of the high risk, but that would be a teacher that would be in high risk. So that I want to highlight that for any of you. I'll post this, but this came out of the KFF, Kaiser Family Foundation. They've been doing a lot of really good research. They also have some good research about, let's see, did I pull it? Disproportionate. Oh, I might not have printed. They also have some disproportionate assessments of individuals, like the hot spots right now. They've also pulled that primarily Latino, so people of color, but Latino populations are going to be greatly hit in some of these areas. So they're starting to highlight some of the racial discrepancies with COVID. The other thing that is being discussed and assessed right now in research is that there are many countries that require a TB vaccine. We don't necessarily require that here in the US, unless you travel. Like I've had to have that vaccine when I traveled to second and third world countries when I was in college and right after. But for the most part, the countries, what they've identified is that countries that have required, this is a one and done vaccine, have had lower mortalities. And they're extrapolating that might be partly a component that prevents the coronavirus from being so overwhelming for some bodies. That'll be interesting to see here in the US, as we do have multiple epicenters. How many of the individuals who've recovered or had minimal impact maybe have had the TB vaccine. I don't know. So I put that out there. Again, this is not to heighten any vaccine debate. We're already debating a lot on this as to whether or not the coronavirus is fake. This is fake news. Everybody's lying. The COVIDiots and the anti-masker mask holes don't even want to wear a mask because it's fake. Or that, the fatality rate isn't where they think that it should be to warrant mask wearing. But at any rate, I want to communicate that there is additional research being done that's assessing why are some countries globally skirting the severity of this. And there's multiple layers to this. And so this is just one of those layers that they're starting to assess. The other thing I want to highlight, going back to mask wearing. So Mississippi, the legislative body, their state legislature, they had been conducting in-person legislative sessions. And many of them have not been wearing masks or not been wearing masks 100% of the time. Well, a sixth of their legislative body has developed COVID. They've been infected. And the majority of these individuals who have COVID now were anti-maskers and were refusing to wear masks. So, the enclosed body of the legislative floor and some of the hearings and things or not hearings, but the meetings and things like that they were conducting has put them at risk. So that's just something also to take in. But most importantly, this data, let me take a little bit of some coffee here. All right, so we're at 21:22. I have to write down my timestamp because that's helping. Let's see, where's my pen? It's helping people who are watching on the replay. They just fast forward. Okay, so today's core topic that I want to talk about is a research article that came out yesterday out of the Nature Medicine journal. And this basically highlights an assessment of COVID and the impact on the whole entire body. And they look at it's how it's affected the quantity of people, but also the extrapulmonary. So beyond the lungs, what other manifestations are they seeing? And they've included blood clotting, myocardial dysfunction, so heart rhythm challenges, arrhythmia, acute coronary syndromes that develop, acute kidney injuries, partially from the lack of oxygen, but also the blood clotting, gastrointestinal symptoms, different cellular blood-related injuries, hyperglycemia and diabetic ketosis, neurologic issues, ocular symptoms, and dermatological complications. And they all look at the ACE2, the receptors in the body being part of that overwhelming growth. And they look at the inflammation and this dysregulation of the immune response as being a core factor for the body being maladaptive to COVID within the system. And so they talk a lot about the mechanisms that are at play. And I really love this. I love body-related system flow charts. I think it's really helpful to kind of understand everything that happens within the body. And so they walk you through the steps and stages of what happens when this virus takes root, and then it starts to multiply, and then all the different mechanisms that it affects. And they basically assess that it gets integrated into the body through the little spikes. And we know that all the gene mutation of this, it now has more spikes that are more effective at implanting and reproducing. And then it triggers the ACE2 receptors. It bonds and binds very productively with that. Then it ends up triggering cytotoxic impact. And we see this affecting, like they break down the different regulatory enzymes, and receptors either get turned on or turned off. So they get overregulated, upregulated, or downregulated. And then we start to see the impact. So we start to see scar tissue. So one of the things they highlight is there's tissue injury or remodeling, that scarring. We know that through the lungs, we start to see that. We see inflammation. There's vascular constriction. So we start to see the blood vessels. There's a blood vessel, small and large blood vessels get impacted. The vascular permeability changes, so the blood flow and the capacity of the veins to function properly changes. We also see endothelial cell damage, and we start to see thrombotic inflammation, which means we start to see some blood clotting occur. And then we see cell damage. So we've seen this in other videos. If you're curious about some of the brain-related neuro-COVID, watch some of those videos. I'll put some links down below. I have a whole playlist, by the way, on this if you want to dig in to how does it affect the brain. But we start to see cellular damage, and we see apoptosis. We actually see cells of these organs and the tissue starting to die. So there's a cellular change and die off. Then we see endothelial inflammation. So this is, they actually have identified what all of this looks like. And it's really critical. We start to see fibrinolysis or fibrinolysis. I think I'm saying that right. But basically, the body starts to create more fibrins. The blood starts, we see clotting. That's the clotting factor. And then we see thrombin production. And so we start to see these microclotting occur. And then the latter part, the fourth step on here, is a dysregulated immune system. And I want to highlight one of the things that they highlight, and they look at in the lab, there are certain laboratory hematological and immune system related markers. So they run cell counts of lymphopenia, the leukocytosis, neutrophilia, and thrombocytopenia. Those are certain labs. There's some inflammatory markers that we see. The ferritin, your C-reactive protein, IL-6. We'll also start to see like D-dimers and then the fibrin levels. But one of the things that they've identified, and what this research I think is really critical for us to analyze, is that the lymphopenia, which is the cellular immunity that gets damaged, occurs in 67 to 90% of all of the COVID patients. That is mind-blowing. So we see a dysregulation of our T cells. Those are your regular standard immune-related response mechanisms. And basically, COVID deactivates our army, our defense system. And so it is a full-on foreign invader. It is a complete enemy when it comes to our immune system. And there's all different types of complications. Some folks will have a few, and then others have full-on multi-system. So when we talk about the multi-systems, and I'll pull the for all of you, and I'll post on my Instagram stories. You guys seem to like that. And now I can actually just drive you to this if you wanted to print this out. But they pull a cute little human body, and then they identify all the different organs and tissue and the involvement with regard to COVID. So we're going to see gastrointestinal, we're going to see the liver, pancreatic, we're going to see spleen and the immune response. We're going to see it, the neuro-COVID, the brain impact. We see this in the vascular. This is more of the blood clotting, the heart, and we also see the pancreas. So this, they've labeled it as endocrine. So there's definitely a whole bunch of hormone aspects to this. But most importantly and critically, what they see is that already individuals who are pre-diabetic or diabetic, this gets further exacerbated. So blood sugars just go way out the wazoo. And insulin doesn't even necessarily regulate. And so they see the diabetic ketosis that occurs. They also see folks that have had no diabetes that end up developing diabetes. And this is one of those potential long-term disabilities. Whether that's resolved or the body's able to balance this out remains to be seen. We need more time. We do know that some of the skin impact, we do see COVID toes correct. We do see the skin irritations, the skin rashes we talk about, balance. But what they're really digging into is, urticaria can occur. You can have different types of lesions. You can have the petechiae. You can have all different types of skin-related challenges. The skin clears up. Some of the gastrointestinal doesn't always clear up. And in fact, they've listed anorexia in here. So there's an inability for the digestive system to actually absorb nutrients, which is a whole nother thing. If you can't absorb nutrients, you can't support your body, you can't nourish it, you can't balance it with good nutrition that you need, multi-minerals, micronutrients, you're not going to see an improvement in cellular changes. So this is quite overwhelming. I just want to put this up here. This is the whole entire body impacted by COVID. And this is where clinical presentations of, we see cardiogenic shock, we see the arrhythmia occur, we see, sudden cardiac arrest. We see folks that they have myocardial impact, the valves, just the dysfunction of the operation of the heart. So there's just a lot to consider in terms of all the impact. They go into the renal elements. There's just an assortment of imbalances. We also see changes and skewed values of potassium and sodium levels, the gastrointestinal aspect. They'll have low serum albumins, and they also see bleeding. One thing, and this is rare, but gastrointestinal bleeding is something, this is the first I'm hearing about it. So gastrointestinal challenges, different pain points, and they talk a little bit about abnormal liver biochemistry. So we start to see folks that might be presenting with other infections like hepatitis A, hepatitis B, or C, along with cardio-related injury. And there's a whole bunch that they dig into. They dig into endocrine-related imbalances. Most of the time, it's going to be the diabetes aspect that they're highlighting, hyperglycemia. So for folks that are managing and balancing their diabetes, definitely having a good monitoring program at home of your blood sugar levels is going to be critical. And I see Lori P says pretty scary stuff. Yes, it is. This is the reality of COVID. And this is why the clinical healthcare professionals are really drawing a significant line on the need to lower the spread. We have more and more people who have this happen within their body. We are going to overload the healthcare system. And unfortunately, when the healthcare system gets stretched, we see a level of care decrease. So maybe it's 45 minutes of a delay for your labs, your blood to get drawn. Well, that 45 minutes could be life or death, especially if you're dealing with ketoacidosis or any type of blood sugar imbalance or blood clotting. I mean, 45 minutes could allow them to give you the dosage of medication to balance or to reduce, to thin your blood and reduce the clotting, the fibrins developing, or you have a stroke or additional complications. So this is why it's really critical. And the other thing too is I've been reading more information about the patient experience. And a lot of individuals have highlighted that they've been delayed in terms of taking themselves to the hospital. And literally they're not going and getting addressed. And that is becoming a much greater mistake, as many of them who are surviving are assessing. Because there's so many manifestations within the body. And we go back to, how overwhelming this is. You also have an overwhelming need for multiple specialties or specialists in the hospital setting. So every one of these systems has a specialist that's going to be dealing with that person. So you have one person in an ICU and they have all of these things happening all at the same time. You've got a lot of professionals coming in and out addressing what's happening. That also taxes our healthcare system. So this is quite comprehensive. They dig into specific labs and also identification what biomarkers need to be analyzed. Like they literally break out, so renal complications. They break out the clinical, what's being presented. Then they take, specific they identify COVID-19 specific considerations. And then they have general considerations. So, looking at certain fluid balance and markers like urinary electrolytes. And these are tests that get run that are going to be critical in evaluating how well that system or organ is functioning. The cardiovascular is quite comprehensive. This is the longest list of items, considerations and other recommendations. So, if this hasn't given you a little angst, this is I think one of the most comprehensive elements that we have right now on hand about how comprehensive COVID, the impact on the body. Christine Fraker, thank you so much for your $10 live super chat. I appreciate it. She says, what are your thoughts on the idea that this has been present already? It just wasn't tested and wasn't recognized. My town was hit hard with respiratory illness in November, December that were negative for flu. So, well, this is one thing that we do know. So this is one version of a coronavirus, that there are other coronaviruses out there. We also do know that at least here in the US so far, they've identified back to the presence of, at least for the people who've been tested. So this is the whole other dynamic with testing. You only are as good as the information that you have to work with. And so given, information of people testing in really not a whole lot in February, but definitely March, April, and May, they were able to identify the gene sequencing. And that's how we've identified that, the virus we're dealing with didn't come from China, even though that's like the news, the story. It really originated from the European strain. So it came in through New York and then spread. What we do know is that there's potential it was here in January. As far as November and December, that still remains to be seen, but we might learn more as more people take tests and we get more data in the system to run. So every day, Christine, I feel like we learn more and more about this to assess, but I do know a lot of people have said, I was really sick in November and December, and I had this hacking cough. It's very possible that it was, I hope Brian, yeah, it looks like Brian's back. It's very possible that there may have been other viruses that we weren't aware of. But your town specifically, they might be doing an assessment from the health department, where you look at some of the morbidity, the mortality rate, the fatalities. They might identify if it was mostly respiratory. But then there's that question mark early in the beginning of our reporting where we didn't necessarily list the people who had a heart attack or a stroke as that being a COVID complication. This particularly identifies, there's just so many different potential causes of fatalities that COVID can create, but also the overwhelming nature of it within the body. And it also too could very well be that maybe that the beginning, the pre this current mutation, maybe that was around. I don't know. But I definitely have heard a lot of people who have said, I was really sick. I will say we had a big norovirus that hit in December. So the norovirus was running around. And, we always do have cold and flu related challenges, and some flu seasons are overwhelming. In my sphere of friends back at home, we actually lost a gentleman in his early 40s from the flu 2 years ago. And that was, talk about a shockwave. You never hear of people in their 40s dying of the flu, and that's quite overwhelming. So I think there's a lot at play. Lori says our local hospitals in Adams, most people go to Rochester or Syracuse, New York for better doctors. Yeah, and that's the challenge with some of the rural, smaller communities. Christine's in Burlington, Kansas, a 1,500 person town. The symptoms were very similar to COVID. It's possible. It's definitely, I think at the end of the day, anything is possible. We are still learning about this. And I think there will be years and years where we look back. I'm sure this happened with the Spanish flu that happened in 1917, 1918. I mean, that was a 2.5 year process. And right now we're so in the thick of it. And, the medical professionals in New York, they're out of the chaos. Now we're seeing Arizona and Texas. And Texas is a big medical community. So I know we're going to get a lot of research out of Texas as well. And Taryn says she has a friend that believes she had it in December. She thought she was going to die. Loss of taste, smell, vomit, tired, cough. Yeah, it's very possible. And I think too, it might be something that for the folks that feel like they had it, the challenge here is we know right now with the antibody testing, the antibodies will be present for up to 2 to 3 months. So that does not bode well in the whole idea of, herd immunity and impact in balancing the body. Or not balancing, but keeping the body healthy and well from getting reinfected. So, I don't know how effective also taking an antibody test would be in assessing how, if somebody had it. So I know that's there's just a lot of gray. And I will tell you, humans, we don't like gray. We want definitives, right? Like we want answers. We want to know right now. And I do see this also sometimes, the underlying element where people are getting frustrated. We don't know a lot. We're learning more. It's human nature to make up stories and ideas that may or may not be founded. And I have to keep reminding commenters on some of my videos to really just look at the data we know right now. Be open-minded. Know that we don't know everything. We won't. But we also have to trust in the scientific process. We also have to trust in the fact that this is novel. This is something we've never seen. Just like, could you imagine you're a pathologist in New York and you're every day probably seeing the same thing, like sclerosis of the liver and certain heart damage and brain stuff. And then all of a sudden you're starting to pathology COVID patients and you're like, what is this? And literally like the organs are looking differently. Just the structure of the vascular channels are just way out of whack. And that puts these scientists in this new zone. They're out of their wheelhouse. They're out of their comfort zone. It also is exciting in that for the scientific programs and the scientists and the researchers, this now lets them do what they do best. They figure things out. And so I do still trust in that process. I know a lot of people want to question it, but at the end of the day, that's where we're going to learn more and more information, and I think we have to, I'll keep communicating it when it comes out. I will say on one of these pages, what is great is they talk a little bit about like future directions for research. This is all that data talking about things we don't know. What do we need to know? They raise all these questions. What are the mechanisms of viral entry into the lymphocytes? We don't know that. Do other organs serve as sites of viral infection and persistence? We don't know. I mean, there's just a lot of stuff we don't know. But this is a really good base level understanding. Again, more questions in terms of, gastrointestinal. This was more questions specifically to the multi-organs. Like the pathology, the neurologic pathology or pathophysiological, they ask, does SARS-CoV-2, so COVID, directly infect neurons? And if so, which neuron types? Like there's just so much to be analyzed. And so, they basically drill down into, it's going to be regional, it's going to be national and international collaborations of clinicians and scientists focused on high quality, transparent, ethical, and evidence-based research practices that would help propel the global community towards achieving success against this pandemic. So that I really love. Now, I want to highlight a few resources that I think all of us should have in our catalog based on some knowledge that we know about these vitamins, over-the-counter supplements in terms of helping your body. And so vitamin D, we do have some research in the COVID world, but vitamin D is critical as a cellular energizer. It's a protective steroid that will help bolster your immune system. So there's some regulation to your immunity. Vitamin D is needed by every cell in your body. So definitely consider adding vitamin D into the mix. There have been studies, I've highlighted them probably 3 months ago now. Like it just seems like it's all kind of blending together. But vitamin D, we've identified that a lot of the severe cases had low vitamin D levels. Is there correlation? Not quite sure, but definitely if it's low, we know vitamin D is very pro-supportive and neurobalancing and good for our heart health and all these other, the endocrine system. It's a good idea to add that into your mix. The other thing that we do know that is powerful, and there is some research specifically to my favorite 3-letter botanical. I'm not going to say its name, but it starts with a C, ends with a D, and the middle is the second letter of the alphabet. That has very immune regulatory properties. And so I recommend that adding that into your daily regimen. You can get in liquid tinctures. They now have soft gel capsules. But that is something that, again, remains to be seen in terms of just how immune protective it is. But we do know if you have autoimmunity and any of some of the underlying health conditions that it can reduce pain and inflammation. One of the main markers that this whole process assessed is just the inflammatory related state. So this whole process, these 4 steps, there's a lot of inflammation that gets triggered by step 2, 3, and 4. And so if you can lower your inflammation levels, it's going to be critical for just helping the body overall manage the degree of inflammation. And you can only take so much inflammation. So that is one aspect. The other thing that I recommend, especially with the blood clotting, is the vitamin K2. I think it is going to be critical, especially if you have any pulmonary or in any type of history of blood clotting, family history, strokes, heart disease, things like that, to balance that. I also love to recommend good, strong omegas. They are anti-inflammatory, and this happens to be a fermented cod liver oil. These two, I'll post these links. This vitamin K you can grab in my Full Script store. You just type in, it's Douglas Labs, really high quality. This is 90 mcgs of vitamin K. I take 2 of these a day just for my own purpose. If you find you bruise a lot, for women, if you have heavy clotty periods, that is indicative of a need for vitamin K. You can also have your vitamin K2 levels assessed. If you are on any type of blood thinners or any medication, talk to your pharmacist. I'm not recommending this for folks, it's just general kind of communication. So definitely if you are taking multiple medications, talk with your pharmacist, talk with your doctor. Don't take my advice as something to run out and take. But K2 is proven to be antithrombotic. So it is an antithesis to the fibrin development. And as we see, the microclots can be a factor with COVID. The other thing that I really love, oh, here it is. Oh, I love this so much. InflameX. So InflameX is a wonderful kind of full overall systemic inflammatory reducer. So this has white willow bark that is both pain relieving and anti-inflammatory. It has turmeric, bromelain. That's a really good enzyme from pineapples. That's anti-inflammatory. Also flushes excess fluid out of the body. It also has Indian frankincense gum resin powder, yucca root, and ginger. This stuff is fantastic. And I have a lot of you that have started to take that and are commenting that you really enjoy that. So, and Christine says, Douglas Labs probiotics are the absolute best. Yes. By the way, thank you, Dr. Melissa, for letting us have access to your Full Script store. I now buy from there exclusively. Oh, yay. Wonderful. Yeah. I mean, I really, my purpose is to help you all make healthy choices and to be well during this whole pandemic and beyond. And, it's one thing to be, somewhat balanced, but the key to living our best and most happy, healthy lives, it's to optimize our wellness. And so there's a whole multitude of resources that you can tap into, and Full Script's great because we have thousands and thousands of options. And I love it. They've got pet products, skincare products. They have vaginal suppositories for folks that have, yeast infections that are really hard to kick. They've got nasal sprays and a whole bunch of really great stuff. So you always get 10% off the Full Script store. And that's always down below. And that does support my channel. But regardless of where you buy this, any of these items, you can definitely bolster and support your body. And that at the end of the day is something you really want to consider doing now, more so than probably ever in your lives, given the rate of expansive, explosive growth of coronavirus, particularly in the heavily hit areas. It's coming to Georgia. Like, we are seeing the rise of it. We're going to be probably hitting 6, 7, 8,000 positive cases in the next week or two. You know, I think I announced, I don't even remember if I did, but like yesterday we had a 70,000 plus a day. That is getting us closer to the 100,000 mark that some of the key leaders in infectious diseases are highlighting, that that's the route we're going. We're going to be in a significant spread. And especially if any of you are in patient or customer facing jobs, I really encourage you to bolster your systems. And some of that also is going to require taking time out and getting the right exercise, being out in nature, and, you know, grounding yourself, putting your feet in the dirt, on grass, sand, and water, especially using the summertime to be out and about. We know we're going to be dealing with this in the wintertime. So get your kind of inkling for being outside as much as you can. But also it's critical that we take some measures to enhance our body. X-Teen Jones, hi, I have heavy bleeding on my period, and when I take K2, it makes it worse. I bleed a lot more. I just wanted to add this in case someone else also bleeds heavily. So the big thing with K2 is I actually don't recommend you take it during your period. You know, if you have heavy bleeding and you haven't gotten it checked out, make sure you get ultrasounds to rule out uterine lining challenges, either thickening of the uterine lining or multiple fibroids. Fibroids are in their own category. I have a whole bunch of video content on that. I had that experience before I had Gabriel, and have a whole bunch of ways of how I resolve that individually, and how I do with my patients. Okay, so Jenny's on the Inflame X. So far, so good. Excellent. Let's see. Okay. Oh yeah, Christine can't take our 3-letter herbal. That is the one challenge, that for folks that do get drug tested, they're, you know, the cleaner, more balanced herbal botanicals might have some traces. You know, the extracts are the ones that are going to be less effective. They're not going to have full spectrum. What's the difference between cell food and trace minerals, and how and when do you take them? Okay, so I don't have the bottles in front of me to tell you the differences, but the cell food is a little bit less abundant in it has trace minerals and it has a few other compounds in it. I take them separately. I also do detoxing. So like last night I did my far infrared sauna. It's a total 40-minute sweat fest. It's awesome. I love it. And then I do a facial mask. I feel great. And I go to bed. But when I sweat a lot, so if you're exercising or doing any type of detoxing, you definitely want to reestablish your electrolytes. So I will take cell food usually before I do my detox. And it depends also on the amount of sweat that I get going. Sometimes I'm better hydrated than others. But trace minerals I'll take in the morning, cell food usually around lunchtime or before my detox. And you can alternate. It just kind of depends on what you feel you need. Okay, let's see. Is it okay to take K2 if I had a partial hysterectomy, and is it okay for my 18-year-old? Yeah, I'd say yes, but check with your clinician. You know, K2 is something we actually gave Gabriel K2 when he was born. So instead of having I think it's an injection. I don't know. They give babies K2 for blood clotting for the purpose of, I don't even know. Like it's not the eyes. We refrain from like all this stuff. And so I gave him little drops and it helped, helped him kind of reset, but definitely smaller children, they tend to say they need to do that. Doc said to take it in flakes. Yeah, I take it as needed. Cell food gel is amazing. Ouchies heal much faster. Yeah, so cell food is pretty fabulous. Diagnosed with bacterial Hibacilla, oxydoca, still coughing now on antibiotic. They swabbed my nose. Okay. Okay, so let's see here. I want to answer some questions, and then I've got to run. We've got Sod in the backyard. Brian he's got a busy day in front of him. It's continuing to transmute and attack organs. The organ attack with COVID is really crazy. And that is just something there's no way to anticipate who potentially could be hit harder. And I think that is ultimately one of the challenges when we're looking at all the schools reopening. I have friends who are teachers who are literally looking at leaving their work. They fall in that 25%. Okay, let's see. All right. How often do you take Inflame X? So you can take this twice a day, or you can take it at night, depending on your degree of inflammation. So let's say you just always feel kind of inflamed, puffy. I love to take this on an empty stomach right before bed. I love to use empty stomach right before bed as a way to really reduce the systemic inflammation. But if, let's say, you've got a pulled muscle or, a torn ligament or injury tear, overwork from workout or whatnot, you could take that a few times throughout the day. So it just kind of depends on what all is going on. And often I will layer. So my 3-letter botanical, love that stuff for a lot of different reasons. And now they've got the gels, which are fantastic. So you don't even have to worry about it tasting. It's a peppermint oil. It's really clean. But folks that don't like the oil, now they've got the soft gel. So I've got a link if you want to check that out. Okay, let's see. Yeah, electrolytes are critical. And one of the things that I really feel like overall globally, we are multi-mineral deficient, and that might be its own topic. But that definitely does help our organs and glands function better. It's necessary for optimization of our body, especially if you're not eating mostly plant-based and organic and maybe even enhanced, in the soils. We need to support and supplement. And so that becomes critical. Okay. I love it. Jenny from the block is doing military code. Okay. So one of the things I do want to recommend down below, if you haven't gotten your face shields, I've got links to those. Also, this one mask vendor, the US mask vendor that has all of these cone shaped masks, they fit, they're very comfortable. Lots of space here for talking, and you can adjust here at the nose. Pretty good. Like for me, it fits pretty well at the bottom. They have 10% off. So there's a 10% off code. You can grab them. But a lot of people order those recently. And then also, my friend has the 3-layer cotton mask. I don't know if you guys have seen Bill Nye, the science guy. He's done a great TikTok about mask wearing, where he has just like a bandana and a candle, and he blows, and the candle gets blown out with a bandana, but he puts 2 layers. And he blows and it kind of moves, but he shows just how much of a blocking these do. I think it's great. But also kids. So for kids, don't forget to grab the kids masks. These are the disposable masks. I am going to be working on some video content today and tomorrow. And I had Gabriel put these on. These are really cute. And they fit my face too. So depending on, your facial size, this might also fit you, but this is for kids 4 to 12. So anyway, check those out. It doesn't work. Should I still take the other fruit? I have a gel. I don't know what type of gel. I would look at your dosage. So with the 3-letter botanical, dosage is critical. And the dosage is going to be per the bottle, not the individual serving size. So the higher the dose, the more impactful, depending on where you're putting it. I love to put the gels like Octagon Biolabs. That's the brand I love. We use them. They have a balm. It's lavender eucalyptus. It's awesome. It's 500 milligram and a 1,000 milligram balm. But I will put that on right over the carotid, back of the neck, like right here, a little reflexology point, and on feet, your feet. Gabriel loves it. Okay, so scary but wonderful information. Yes, certainly it is. And the dogs are barking. I definitely want to equip you all with the latest research. And this, to be honest with you, this is going to be huge. And the questions they raise is going to also help additional researchers drill down further. But the epicenter is here in the US. Our research is going to be based here in the US, and that's what they do best. So, all right, friends, I've got to run. Dogs are barking. Instagram's going off. And I will see you guys Monday. Look for some video content tomorrow. And do check out the links down below. Thanks, everybody. Bye, Instagram. And thanks, everybody on YouTube. I appreciate your time. And Pat, thank you for moderating. You guys are fabulous. And thanks for the super chat. All right. Bye, everybody. Have a good weekend. See you later.